and then beyond that, we'll focus on senior-heavy communities. And the idea is our view on testing, Dr. Ladapo will talk about it, is if you're just young and healthy, you don't need to be running out and getting tested every day. Really, testing is supposed to lead to a clinical result, or what's the clinical response if you have a positive test. Well, clearly, when you're talking about long-term care facilities, you're talking about senior communities, those are the demographics that are going to be more likely to take a positive test and then parlay that into treatment, which we do support and want to get very quickly. So that will make a difference. It makes it better for the elderly. You don't have to wait in a line. The stores, I think, will start to get more in, but they go very quickly, and you have some people that'll buy up a lot of the tests, and it makes it tough. So the people who the testing is going to be very high value for, that's where we really want to see the access to. And so we are doing that, and this really follows from a lot of the policies we've had where we've tried to put seniors first, just recognizing that seniors are at greater risk. Now, fortunately, the Omicron variant is far less pathogenic than the Delta variant or even the previous iterations up to that point. What we're seeing is way, way more contagious. You're seeing it spread way quicker than you've ever seen any of the other variants spread. But the flip side of that is that it is less lethal, which is really good, and really is kind of what you would expect as a virus like this evolves into something that is going to be endemic. It's not something, and I've been saying this for a long time, but it's not something that's going to vanish off the face of the earth. It's something that's going to be here, we're going to live with. But between the prevention, the treatments, the acquired immunity, it'll be something that will not, hopefully in the future, impose really significant burdens on people in terms of clinical outcomes. Now, you do still see some people being hospitalized, but I think what we've seen in Florida is the people that are the most severe cases still tend to be the Delta cases. Most of what we see in Florida is Omicron, but it's not 100% Omicron. So we're in a situation now where we understand the deal here. We understand most people are going to be fine, but if we do have vulnerable, whether it's Omicron or Delta, get that at-home test and then get the treatment, and that's something that'll be really, really good. I don't know if there's any prospect of the federal government following through on what it said it was going to do. I don't even think they have the contracts done for this, and to have promised people could go online and order, that's a very tall thing logistically. I mean, we've worked through a bunch of stuff with the vaccines, with the monoclonals and everything, and some of this stuff is easier said than done. So we see an ability to help, and so then what we're going to do also is monitor the demand, how many other places, so it won't just be nursing homes or long-term care. We'll send them to places like we were at Kings Point when we did the first senior community vaccinations. We can send them to other types of those communities, and then this way they just have it. And again, it's not really to just test, but someone develops a symptom, you go in, you have an at-home test, you can get a result, and then proceed to treatment. And that's something that's really, really good. The monoclonals, we have asked for, I think as many of you know, an increase in the allotment. We got severe reduction back in September. We were using them very effectively. You'll hear from some of those stories here. That reduction made it more difficult for us, but because we were able to do a deal with GlaxoSmithKline, we got thousands of doses to be able to paper through any type of interruptions. We didn't really see very much interruptions with the cuts that we saw because the demand declined very significantly. We had very low prevalence for a number of months. Well, now as you see the prevalence go up, you do see the demand for the monoclonals to go up, and we want to be able to meet the demand for our high-risk individuals, like in a nursing home, like our senior citizens. And so we were told earlier this week from the company that sources it that they were going to source the 30,000 doses that we asked for. Then HHS said, well, wait a minute, not so fast. Where does that? So the bottom line is we're just waiting. We don't know what's going to happen with it. Clearly, there's been a different approach based on what state is asking for it. I think that's very unfortunate. I don't think that should be the case, but that is absolutely the case. New York has 3 million fewer people than we do. They're getting way more monoclonals than we are. And I got a lot of New Yorkers down in Florida as well that we take care of. And we serve everybody. I mean, you get your high risk and you go in for monoclonal. I mean, we're not making you show that you're a Florida resident because we want to help people. So you have all that, but that's just the reality that we're seeing. So we're going to keep fighting to do that. We have the ability to do a site in Palm Beach County, which we will do. Broward, Miami-Dade, Central Florida, Southwest Florida, Jacksonville, you name it. And we already have a footprint, but this is a footprint that's only getting a very finite number of doses. And so as the doses increase, we then expand the footprint, accessibility becomes better, and then folks are able to get the treatment that they need. So we're asking for the 30,000. We have the infrastructure in place. We have resources in place. We asked the legislature after the Delta wave, we didn't know what was going to happen, but we said, look, if there's future waves, we want to be able to respond and meet the demand. So they set aside almost $1 billion in the legislative budget committee from October so that we have it. So we have everything we need except for HHS releasing the medication to the state of Florida. But I'm confident we're going to continue plugging away. But in the meantime, where we're not seeing the action on at-home tests, we're stepping in. This is a great start to help the nursing homes and the elderly, and we'll continue to expand in different communities as there's demand for it. To be able to get these at-home tests. I want to thank Kevin Guthrie at Division of Emergency Management for working very quickly on this. Also thank Joe Latipo for, he's going to be publishing the new testing guidelines. And again, we're a free state. We're not saying you can't, if you want to test every day, you can. We're not going to impose any type of restrictions. If that's something that, if you want to go buy every test in CVS, it's a free country, it's a free state. But what makes sense from a clinical perspective, and Joe will lay that out in the memo, but basically the testing really, we want to tie that to outcomes that you're trying to get. And if you're just somebody that has no symptoms and you're not at risk for anything significant, to be going out and testing a lot is not something that's going to be considered high value testing. Likewise in workforces, to force someone to be testing before they go to work is not going to be really high value testing. And I think the danger that you have for it is what impacts that could have on society. For example, we rejected the CDC's quarantine policy at the beginning of the school year and said, if you're symptomatic, absolutely, send the kid home. But if you just happen to be exposed but you're healthy, to deny a child the ability to be in school, that has huge costs that are associated with that. And likewise, when you're talking about the workforce, if someone tests positive on a PCR test but has no symptoms, that may not even be live virus, because you could test positive for a couple months with a PCR test. So that person may not even be contagious and have live virus, and yet they're going to be taken out of the workforce and be home. So that's a huge cost that happens with that. And so having a more targeted strategy, I think, will lead to better clinical outcomes. It'll make it easier for the seniors to get the test when they need it, but it's also not going to impose some of those costs on the back end that are not, they're not intentional costs. People are trying to be helpful with the testing. I don't begrudge that, but at the end of the day, we need to make sure that healthy people, whether it's healthy kids or healthy workers, are able to participate in society. And so Joe has outlined that. He's going to be able to publish that very soon, and I think that will hopefully bring some peace of mind to some folks, because I think when the Omicron started going, a lot of people feel, I got to go out and see if I have it or whatnot, and you really don't in the general circumstances. There may be special circumstances. We've always supported more rigorous testing with staff at nursing homes for obvious reasons, because of the environment that you're in. But for the general public and particularly the working age and school age populations, really the symptoms-based approach is the better way. So I'll let Joe Latipo come up here and do it, but we are happy to be able to have secured these tests in the midst of this shortage, and we're also happy that we continue to put our seniors first. Joe?
All right. Thanks, Kevin. Trying to keep this apple from rolling off here. Okay, I found a safe space for it. Okay, well, good morning, everyone. The governor has set a model that is just sort of continuing today, which is sensible public health. So we've obtained tests and we're directing them to where the tests are most likely to have a benefit, which is in communities and environments where high-risk individuals reside. So this is sensible public health, and it's the very opposite of what we've seen over the last 2 years, where, for example, people have made it leadership at the national public health level have sort of convinced people that it's just as important to run around testing middle schoolers and elementary school students as it is to be testing other members of the population, even though their risk is 10, 100, or even 1,000 times higher from COVID than these small children. So this is sensible public health. This is the example that we're setting in Florida, and this is absolutely the example that we're going to continue to set. We are not going to be following completely insensible, wasteful, harmful, ridiculous policies for public health that we're seeing, largely characterized as the policies that we're seeing at the federal level. The governor talked about testing. So I want people to know that what's happening now is what's abnormal. So testing people for a respiratory virus when they have no symptoms on a massive scale is abnormal. What we did before this pandemic is what was normal, which is if you have symptoms, we'll test you. And if you test positive, we'll treat you. That's how it's been. This is what's abnormal, what's happening now. It does not make sense to be running around with swabs testing people who are completely healthy. It sounds radical, but I think if any of you who have kids, one of the beautiful things about kids is they're so simple with things and they're honest. If you have kids, compare what's happening with nationally with what we're proposing here in Florida. This is so much more sensible. It's also even more sensible considering the amount of natural immunity that's out there in the community, and the fact that people who have risk factors can make decisions over whether or not they want to accept one of the COVID-19 vaccines. So that's the direction that we're moving to. As the governor said, we're not restricting access. We're just basically sort of unwinding the thinking that the national leadership has managed to unfortunately infuse many Americans with, and it's this notion that if you're healthy, you still need to go get tested for something so that you can determine whether you're sick. Think about that. So that's our testing guidance. And the one additional thing I'll say is I just want to repeat, we're in the middle of a surge. I've said this very often. It's important to us that people who have risk factors get tested when they have symptoms and that they get connected with treatment. So, we're expanding monoclonal antibody availability thanks to the governor's leadership, and we're also expanding availability to oral medications, including the Pfizer and the Merck products, and providing some guidance about off-label medications such as fluvoxamine and inhaled budesonide, both of which have shown very good evidence for effectiveness in randomized clinical trials. Okay, thanks.
Thanks. All right, we have Kevin Guthrie, Division of Emergency Management.
Thank you, Governor. Good morning, and thank you again for your leadership on this important topic. This testing initiative, is just another example of where the division has shown through this pandemic, and as I keep saying, we're built for speed and a very quick turnaround. Less than a few days, we've been able to secure nearly 1 million at-home tests and make them available to nursing homes and long-term care facilities. I can tell you that starting today, each and every nursing home and long-term care facility will start to receive. We will ship those products out today, and they will start to receive them over the weekend, and that will happen. We'll send a first supply, and then we'll allow them to allow the long-term care facilities to ask for additionals if they should need them. And as I have said all along, we are the logistical support arm of the Florida Department of Health and the Agency for Healthcare Administration, and will continue to do that. I think on the monoclonal antibody situation, I do want to let you guys know, at the direction of the governor, yesterday I sent a letter to Secretary Becerra with HHS, letting them know that if they needed any assistance in logistically moving the product of monoclonal antibodies from the warehouses across the nation to the state of Florida, that we will activate our logistical trucking contracts to go and get that product and bring it back here expeditiously. So again, for your leadership, Governor, I thank you very much.
Okay, now we're going to hear from Wayne Uffelman. Is going to talk about his family's experience with getting treatment for COVID. So why don't you guys come up?
Good morning. My wife, Kim. My caregiver, because without her, I don't know if I would have survived. I was very sick. And I guess we got it pretty early, in August, late August. And,
my husband got sick first, I got sick second, and my 94-year-old mother got sick third. And he got the monoclonals about 8 days in. I got it about 4 days in. My mom got it within 24 hours. It stopped him dead in his tracks with progression,
yep,
right?
Yep, and thanks for opening the center right around when we got it, fortunately. And it turned.
You did the one in Palm Beach?
West Palm.
West Palm.
Right. And it turned me around.
Your mom did where?
Fort Pierce.
Fort Pierce. Right. But it turned me around. I mean, I was really sick. And I had a high fever after the shot, but then the next day I started to come around. I was real close to going into the hospital. And that's, you don't want to go in the hospital. So, I'm just so grateful.
Yeah. And how did you know about the monoclonals?
We watched the news, but we also went online and looked it up. But we heard you giving. We watch you quite often. So,
okay. Good.
So, and if you find out a lot of stuff, living in Florida is a great place to live.
It is.
Not the only one that thinks.
Spell your name for us.
It's Uffelman, Uffleman. His first name's Wayne.
Thank you.
Yep.
All right. Well, thank you.
Yeah,
Appreciate
thank
it.
you.
Yeah. Thanks
Thank you so
much.
much.
Yeah, of course. And one of the things we saw over the summer was when people would get it, keep them out of the hospital, which is obviously what you want. We had some very elderly and very, with patients with a lot of comorbidities who were vaccinated, but then they got COVID, started developing symptoms, did the monoclonal. Some still got admitted to the hospital, but then they would recover and be discharged, and a lot of times they'd report that the physicians were telling them, had you not done the monoclonal, we don't know that it would have progressed this way that you did. And so the initial goal is just keep them out of the hospital, but if you're admitted, but then you don't ending up on ventilation, and if this is part of what's helping, then that's a big deal. That's another thing that we're seeing that I think is also worth pointing out, and it is a positive trend, is the number of hospital admissions that end up on mechanical ventilation is much, much lower with Omicron than it was with the previous iterations like Delta and Alpha. And the reason why that's important is because if you're not on mechanical ventilation, your chance of recovery is much, much higher to be able to recover and be discharged. Once you get on that mechanical ventilation, that's when you're really in a fight for your life. And so, and some people recover off that. It's not like it's 100%, but man, once it goes, that stuff. So that's I think a fact of an outgrowth of the fact that the Omicron is more of in the upper respiratory, and it's not getting into the lungs the way Delta did. And so that's a good thing to be seeing compared to what we have been seeing. Now, there's also this notion. There was a lab test done like a month ago, and someone reported, hey, there's a study, monoclonals don't work against Omicron. And then they said, well, maybe the sotrovimab, which we did buy some, we've used it all, they send us some sotrovimab, but they're like, we don't think the Eli Lilly or the Regeneron works. But Dr. Latipo and I looked at that, and it's like, okay, that is one data point. That was not a clinical trial. And then we started talking to practitioners who said they have seen Omicron symptoms resolved. And so we think what we're seeing is probably that the Lilly and the Regeneron may be not quite as effective as it was for Delta, but if it's 50% effective and you're somebody that's high risk, that's something that you would want to see a reduction. So there's going to need to be a lot of different trials, but we don't have the data to definitively say it doesn't work, just as we don't have enough data to definitively say, it works just as well. We think it's probably somewhere in between. But if the choice is sitting on the shelf helping nobody, if it's on the shelf, there's a 0% chance it's helping somebody. If we're getting it, even if it's a 30, 40, 50% reduction, that matters. And so we want to be able to provide that for folks. And so the monoclonals, though, of all the things that we've seen, they performed at the level of the clinical trial over the summer. I mean, when people were getting them, you would see it was very common that their symptoms would resolve in 24 to 48 hours and they would not go into the hospital. That was the standard response that we would see with that. And so that was something that was good to see. We'll see now with Omicron. I mean, of course, there's less likely to progress in a serious way than with Delta. So how you kind of figure that out or see when the dust clears, that remains to be seen. But I do think it's inaccurate if people are saying, oh, monoclonals don't work against Omicron. That has not been definitively shown at all. And anecdotally, we do have evidence that people have had positive outcomes. Okay, now we have Aqua Secretary Simone Marsteller.
Thank you, Governor. Just briefly, I want to make sure that everyone knows, right, in the state of Florida, we have some 700 nursing homes and some 3,000 assisted living facilities, which is clearly why Governor Desantis wanted to make sure, and has done from the beginning of this epidemic, or pandemic, I should say, to take a seniors first approach and to make sure that the seniors who are residing in our nursing homes and ALFs have access to not only the vaccines, third doses, boosters, monoclonals when they became available. Because of the governor's Seniors First strategy, Florida led the nation in vaccinating seniors not only in these long-term care facilities but across the state of Florida. And because of the governor's leadership, Florida led the nation as well in making sure that staff and residents inside our long-term care facilities had access to vaccinations and monoclonals. I want you all to know as well, and I'm going to pick up a little bit on what Kevin was talking about, there is an entire structure that is happening behind the scenes to make sure that these individuals get the resources and the information that they need. My agency, the Agency for Healthcare Administration, partners with the Department of Health and the Division of Emergency Management to make sure that we are coordinating our efforts in an unprecedented way under this governor's leadership to get these resources and treatments into the hands of the individuals who really need them. Among the things that the governor has directed us to develop are strike teams. So whether it was with vaccines or the monoclonal antibodies, where there was a need inside a long-term care facility, we coordinated strike teams to come in and deliver those treatments and to make sure that if people wanted or needed to be vaccinated or get the monoclonal treatment, that we brought people in to help make sure that the residents remain safe and healthy. I want to take this opportunity to say statewide what an incredible job that our health caregivers in our long-term care facilities have done over these last nearly 2 years. I know it's been a challenge. I have gone visiting myself. I've talked to them, and I salute them. They have done an incredible job keeping our residents safe. And we're going to continue that push with the governor's support, and I thank him for pushing the federal government to get monoclonals in here. We're going to continue to make sure that these resources get to our long-term care facilities for the residents and for the staff. We want to make sure that our residents can be visited by their loved ones. We want to make sure that we're helping maintain the right protocols so that everyone can be healthy and safe. And I want to thank you, Governor, for your work on that regard.
Absolutely. Okay, Valerie Gray coming up. Where are you?
Good morning. Thank you, Governor, for the opportunity to be with you today as you continue your work to safeguard Floridians. I also want to thank Secretary Marsteller and Surgeon General Lapato for their continued support of our state's long-term care centers. I am Valerie Gray, administrator here at Rehab Center of the Palm Beaches. We provide skilled nursing care, including post-acute care and short-term rehabilitation services to seniors and people with disabilities in Palm Beach and the surrounding communities. We are a 5-star rated facility and a National Civil Quality Award recipient. We deliver exceptional care and while providing quality of life to our residents is our top priority. We are also a member of the Florida Healthcare Association, which represents over 600 skilled nursing facilities and assisted living facilities across Florida. Throughout the pandemic, our caregivers have worked tirelessly to protect our residents and ensure they were well cared for. We calmed their fears in the face of the unknown. We lifted their spirits and held their hands when they couldn't be with their families. And we shared their hugs when they were finally able to reunite with their loved ones. The governor's leadership gave us hope and has helped us persevere over these past 2 years. He prioritized our residents and staff, making decisions that help keep the long-term care community safe. Many of the decisions he made were difficult, but they saved lives. And he continued fighting for our long-term care facilities as vaccines and life-saving monoclonal antibiotic treatments became available. Once again, the governor put us first, and as a result, our care centers are better equipped to manage the virus, mitigate its spread, and protect our residents and staff in the midst of COVID-19 surges. The governor's innovative thinking to make these test kits, the treatments, and other resources readily available to our seniors is what makes our state a leader in this fight against COVID. The pandemic is not over yet for our healthcare heroes who are fighting every day to ensure our residents are safe and receiving the best possible care they expect and deserve. But we know the governor remains committed to helping us keep fighting while at the same time rebuild and recover from the impact of COVID. His most recent Freedom First budget proposal is another great example of that, and with the increased Medicaid funding he has proposed for our nursing centers. On behalf of the thousands of long-term caregivers we represent and the residents who are entrusted to our care, I want to thank you again, Governor, for your leadership and your ongoing support. Thank you.
Thank you. So we're excited to be able to get these at-home tests. You don't have to go wait in line. We're happy to be able to get that to these facilities. And as many of you know, we're a very big state. We've got a lot of these facilities here. So I don't know that they'll need all million of them, but they're going to use a lot of them to start. But we also are going to try to get more and then send them to other communities that may not be a long-term care, but have a lot of need for a senior population to be able to have an easy access to a test that you could just do in your home. Also, just looking at how Omicron has worked throughout South Africa and then in Europe. And then now what we're seeing here is that, it shoots straight up, unlike any viral curve we've seen yet throughout the pandemic. But then when it does peak, it goes down very quickly. And so we're going to be monitoring that here in Florida. I'm not saying that it has peaked yet, but it is likely when it does to turn down very quickly, because you have so many people who are being exposed to it and are getting infected. Most of them don't know they're infected, and that's what will happen. So we'll be monitoring that, but I do think that that's likely the way the Omicron strain will go. In some of the Northeast and some of those, they still have more Delta than we do, because they didn't go through a Delta wave. When we had our Delta wave in the South, they tried to politicize that, but then they've got it in the Midwest and now in the Northeast. And so we'll see how that shakes out. But for us here, we have overwhelmingly it is Omicron, and if Omicron completely displaces Delta, that in and of itself will save a lot of lives. So we hope that is actually the case. Questions?
Mr. Guthrie.
Yes, sir.
So I wanted to ask you a question about an interesting situation happening in NASCAR. We have a lot of Floridians that follow NASCAR, Right now, you are watching Governor Desantis speak in West Palm Beach as he's making the announcement today that his administration has its hands on almost 1 million at-home tests, and they are going to be given out mostly to seniors, specifically the ones right now in long-term care facilities.
Yeah, this is a part of the governor's Seniors First initiative here, saying that they want to send these tests out where they are going to be the most beneficial. So we are talking about nursing homes first, and then long-term care facilities, and then followed by, senior-heavy communities like Kings Point, places like that, that we have here in South Florida. But they are just saying this sort of access will really make a difference for our seniors here in Florida. They don't have to go wait in line. They can take these tests at home if they have symptoms, and then they can get treatment.
I'd say that starting today, these tests are going to be sent out starting today. Also, making the point that, as we've heard from him almost every day here this week, is that he's pushing the federal government to get more monoclonal antibodies here in the state of Florida. He also denied a report that we've talked about here on CBS 12 News about that said the federal government is holding on to those monoclonal antibodies, saying they're not as effective against the Omicron variant. Governors disputing those claims, saying there's not enough science about that, saying maybe it's not as strong against the Omicron variant as previous variants, but they can still be helpful. So he continues to ask the federal government to get those antibodies here to Florida.
Yeah, he is asking for an additional 30,000 doses right now. And like Matt just said, he's saying there's no evidence that it is not as effective against the Omicron variant. He says, it won't do anyone any good just sitting on a shelf. So they want to get them here to Florida. We heard the Division of Emergency Management even say that we would use our own trucks to get those shipments here if necessary.
We are currently now in CBS 12 News at 9 o'clock, and we are awaiting President Biden speaking in Washington, D.C. here a year after the January 6th riots at the U.S. Capitol. So once President Biden starts speaking, we will check in with him. But as the governor continues to speak, let's listen in a little bit more to what he has to say as he's taking questions from the press.
Everybody that's in the facility is not going to get a test right off the bat. We're going to do sensible-based approach testing for those long-term care facilities. And then the reorder process will be completely online. We've already got that portal set up so that, for instance, people will not have to go from here to the Palm Beach County Emergency Management Agency or the health department. They'll be able to go straight to a portal and ask for an additional allocation of those at-home test kits.
Another 1 million in Palm Beach County here specifically, how much of that portion will be allocated?
It'll likely be just, if you look at, Palm Beach has a lot of facilities, and so it'll be on a per capita. So, Palm Beach will get relatively a lot because they've got a lot of facilities, and so it's going to be done that way. One thing I think is just important to think about as we're doing this, and they're ramping up now because the shortage of tests, they're trying to get more into the market. If Omicron goes up and down as quickly as it has in other places, you could find yourself with a lot of tests on the market all of a sudden in another month or 6 weeks. And so we want to make sure we're doing 1 million, and if the demand's still there, we want to keep helping. If we can fill a need that a need can't be filled commercially or whatever the feds are doing, we want to be helpful. But through most of right before the last few weeks, there were plenty of tests out there commercially and everything like that. It was really the Omicron and now the big crunch nationally. So we're helping to alleviate that, and we'll continue to do it. But we are going to monitor how the course of this is going, because if it crashes like it did in South Africa or like it did in some of the European countries, you will absolutely see the demand for testing decline. I can tell you, we had in Florida, you go back September, October, November, it was very, very low demand for testing because there wasn't a lot of COVID going around. Then Omicron came, and when we got into mid-December, you started to really see the demand increase. But I do think that as Omicron peaks and goes down nationally, not just in Florida, that is absolutely going to affect this market. So we want to just make sure that we're responding to fill the niches, but also understand that there's probably going to be a lot of these things dumped on the market, in another couple months.
Governor, about a week ago,
Go ahead.
About a week ago, Agriculture Commissioner Nikki Fried put out an official statement accusing you of stockpiling COVID tests that were expiring soon. Is there any truth to that? Can you speak to that?
Kevin can talk about what they have at DEM.
Yeah, so what we had, again, to piggyback on what the governor just described as a downturn, and we did not have a demand for testing, we had between 800,000 and 1 million test kits, Abbott rapid test kits, in our warehouse that did expire. We tried to give them out prior to that, but there was not a demand for it. We received a 3-month extension on those test kits, which ended up expiring between December 26th and December 30th. Prior to that date, we did ask Abbott and the federal government for another 3-month extension on those so that we
Once
could
again,
use
you've been
those.
listening to the governor host a press conference in West Palm Beach to say that he's got his hands on 1 million at-home COVID tests right now, and he's getting them out to senior centers all over the state of Florida.
Yeah, that is going to start today. They're going to send those shipments out today, and those senior facilities here in the state will start getting those supplies by this weekend.
And once again, we are waiting for President Biden to start speaking from the U.S. Capitol on the 1-year anniversary of the January 6th attacks there. We will get to that and the rest of CBS 12 News at 9 after this.